In this video, we'll help guide you on building your team and operations in the life science and medtech industries. Today, we'll cover the critical elements of assembling a powerhouse team and designing operational strategies to thrive in these complex, high-stakes sectors. Let's get started. Your team is the backbone of your startup. In life sciences and medtech, success demands a multidisciplinary approach. No single person can do it all, and you need a blend of scientific, medical, engineering, and business expertise. More specifically, you need scientific expertise that fuels the research and innovation. You need that medical knowledge to ensure that your product meets clinical needs. An engineering team transforms concepts into functional devices, and business acumen guides funding, partnerships, and market entry. So imagine if you were a physician with a groundbreaking idea, partnering with an engineer to build a prototype and a business expert to secure funding could be the difference between a concept and a market-ready product. Companies like Intuitive Surgical, creators of the Da Vinci robot, succeeded by uniting these diverse skill sets. Skills alone aren't enough. Your team must share a unified vision and mission. In an industry with long timelines and tough challenges, alignment fosters grit and resilience. Without it, even a talented team can unravel. Research shows misalignment is a top reason startups fail. Ensure every co-founder and early hire is passionate about innovating to impact healthcare. Your mission is your glue. Here are some pivotal roles for your medtech or life science startup. Number 1, a founder or CEO. This person is the visionary leader with industry insight. Next, you have a chief scientific officer or chief technology officer who drives research and development with scientific, medical, and engineering expertise. Next, you have a regulatory affairs specialist who helps you navigate the FDA or international regulations, a must in this field. And depending on your business, you may also need a product development engineer who turns ideas into prototypes and products. And lastly, you need someone to handle the business development. These people secure partnerships, funding, and marketing strategies. Each role is a building block, and for example, Medtronic Stent Innovation relied on regulatory experts working alongside engineers and business strategists. At the end of the day, these are just some examples of titles, and each organization will look different based on your resources and based on your network. Finding talent is key, and one way to do this is to leverage your networks in several ways. Reach back out to contacts from your university, past employers, or industry events like Bio International. Think back to conversations at conferences. Someone you met might share your mission. And use platforms like LinkedIn to connect with experts. Offering equity can align incentives, but your vision must inspire. Top talent joins for purpose, not just pay. Sell them on transforming healthcare. Build a culture rooted in innovation, learning, collaboration, and ethics. Innovation and learning is important because it encourages continuous education. In uncharted fields with limited research, your team must stay curious and agile. Collaboration is important because lean startups need seamless cross-functional teamwork, clear organic communications so it reduces friction. Lastly, ethics and compliance is paramount. Integrity is non-negotiable in healthcare. Patients trust hinges on it. At the end of the day, your culture defines your startup's identity, and the good advice is to nurture it early. Operation in this sector faces two big challenges. Number 1, there's long development cycles. Unlike tech startups with rapid, minimal viable products, medtech can take up to 5 to 10 years from concept to market, requiring substantial capital and patience. Assemble a team ready for the long haul. And number 2, it's the regulatory hurdles. Compliance isn't an afterthought, it's the foundation. Build operations around a quality management system from day one, include design history files and protocols to avoid delays. These are not misconceptions, they're realities, and you must plan accordingly. Manage R&D with focus and collaboration. Firstly, you want to be strategically focused, and this means to prioritize projects with the highest impact. Review your design inputs and outputs. Focus on features that deliver the most clinical and market value. When it comes to collaboration, partner with academia or contract research organizations, also known as CROs, for expertise. Genentech's university collaborations, for instance, accelerate R&D without ballooning costs. Smart R&D turns limited resources into breakthroughs. Prepare for scalability and quality control. Based on how you want your exit strategy to be for this startup, there are some things that you need to consider as well. If you're developing a product, you need to think about scalability and quality control. For scalability, plan for growth from the start, even if production is small. Understand your supply chain end to end, and over-reliance on contract manufacturers can stall scaling. For quality control, rigorous standards are non-negotiable. In medtech, product failures can harm patients and sink your startup. Own the process, even if outsourced. Control your supply chain. It's your lifeline to the market. Now here's a short preview as we discuss more in our intellectual property video. But at the end of the day, protect your innovation. Patents secure your technology early to shield it and attract investors. And IP can be up to 80% of your valuation. Trade secrets, some know-how like manufacturing tricks and secrets might be better kept confidential. At the end of the day, consult an IP expert, and your strategy is both defense and leverage. Funding in medtech and life science is challenging because it's high costs and long timelines demand meticulous planning. Forecast for regulatory milestones and trials, diversified with grants such as small business innovation research grants, venture capital, and partnerships, and assign a team member to manage this. It is indeed a full-time role. A solid funding strategy keeps your vision alive, and we discuss this topic in greater depth in our funding video. In conclusion, your team and operations form the bedrock of your life science or medtech startup. Build a skilled, passionate team united by a mission to innovate. Design operations that are efficient, compliant, and scalable. The right team executing a thoughtful strategy can bring life-changing technologies to market.